Good, thank you. So this time I'm going to present a study which has been published this year. It's a small study, it's a Chinese study, and it's about the effect of acupuncture combined with aerobic exercise for coronary heart disease as a part of cardiac rehabilitation. So the aim of this study is this study observed the effect of acupuncture treatment on cardiopulmonary exercise ability, blood lipid metabolism, and psychology of patients with coronary heart disease, and explored rehabilitation strategy suitable for Chinese national conditions. So that was the aim of the study. The subjects that they included in the study was 60 patients. They were between the age of 18 and 85. They had shown stability in the symptoms and also had a stability in their medication dose for at least 2 weeks. And they had also found at least one major coronary artery stenosis by examination or what is it? Radiology. No, never mind. I can't remember what it was, but they found at least one of these as well. So it's a small study with a small group of patients included in it. They had two groups. They had one control group, and the control group was prescribed exercise, aerobic exercise. The amount of exercise each patient was prescribed depended on how they did in some of their physical tests. So they had to do exercise 3 to 5 times per week. The duration was 20 to 30 minutes each time, and they should do it for a total of 8 weeks. In the experimental group, it was the exercise, again the same as in the control group, and they also had acupuncture. And the acupuncture treatment was for 30 minutes and 1 to 2 times per week, and a total of 12 acupuncture treatments. So depending on how many treatments they got per week, it was a little bit different on how long time it took. So some of the acupuncture points that they used, depending on where the patient had symptoms, they looked at the chest discomfort, insomnia, shoulder pain, lower limb pain, and knee joint pain, and which acupuncture points you can use for that. So for chest discomfort, they used pericardium 6, REN 14, heart 7, REN 4, REN 6, and pericardium 7. And for insomnia, they used DO 20, kidney 6, liver 3, and shoulder pain, they used large intestine 15, Sanjiao 14, small intestine 9, large intestine 11, and Sanjiao 5. And for lower limb pain, they used spleen 9, bladder 57, stomach 38, stomach 36, stomach 32, and gallbladder 31. And if they had knee joint pain, they used the extra point EXLE5, spleen 10, and the extra point EXLE2, and also gallbladder 34. So depending on where the patient had the symptoms, they would use a range of these different points. Then before they started all of the treatments, the patients had to do some cardiopulmonary exercise tests. They also got their blood drawn to do different biochemical indicators, and they also had to reply on 2 questionnaires, one with depression and another one with anxiety. So the result of the study was that before the test, there was no difference between the two groups when you look at all of the gender, age, and all of the test results that they did. There was no difference between the two groups. After the treatment and/or exercise, both groups improved significantly in the exercise test. The blood lipid decreased significantly in both groups as well. The acupuncture group had a significant effect on the heart energy metabolism, and the only exercise group did not have that. And in the depression and anxiety questionnaire, the scores were significantly better in acupuncture, and only the depression score changed in the exercise group. So with regards to the anxiety, there was no significant difference in the exercise group. They only had a difference in the depression score. So that is really good. So they concluded that acupuncture can improve the efficacy of exercise ventilation, promote fatty acid oxidation, improve anxiety and depression symptoms, and treat somatization symptoms in patients with coronary heart disease, and combined with aerobic exercise can improve cardiopulmonary exercisability of patients and reduce blood lipids. So all in all, both exercise in itself is really good for people with coronary heart disease, but when you combine it with acupuncture, you get a much more better effect on it. One of the limitations in this study was, of course, the number of patients in it. It was a quite small study, and also that they were not able to set up a sham acupuncture control group because it proven difficult for people to join if they did not experience any effect of the sham acupuncture. So they suggest that you should do a similar study and expand the sample size of the study, and also to do a long-term follow-up on the patients sometime after they have ended all of the treatments.